Greetings, Eric Backer back again, naturopath from New Zealand. I'm the author of a book called CanXida Crusher. Thanks for checking out my video today. Today I'm going to do a series. There'll be multiple videos in this particular series relating to IBS or irritable bowel syndrome. So if you watch this video is what is irritable bowel syndrome, but there'll be other videos in this series. For example, the signs and symptoms of IBS, tests and diagnosis for IBS, best diet for IBS, best treatment for IBS. So there's IBS and there's IBD, irritable bowel syndrome, inflammatory bowel disease. So they're two separate things. So we'll have to talk some other time about inflammatory bowel disease because this is irritable or an irritated bowel itself. So generally we're talking about the colon or the large intestine here. So this condition can have been called historically many names, over a long period of time. Spastic colon, spastic bowel, colitis. If you live in England, it might be called a dodgy tummy. I don't know if you guys in America know what dodgy means, or a dicky tummy or a dodgy tummy. People generally with IBS are not often taken seriously by the medical profession, unfortunately. So if we look at some of the statistics of irritable bowel syndrome, let's run through those first. It affects about 10 to 15% of the whole population. So quite a few people who've got this condition, in fact, don't even know that they've got it, because only 75% of people with irritable bowel syndrome, in fact, don't even seek help. They just learn to live with a digestive system that creates all kinds of symptoms and signs, which we'll discuss a bit later. About 1 in 4 people with irritable bowel syndrome actually seek professional help. So about 3 out of 4 don't. They just go down to the chemist and will take pills, and they'll self-medicate. They'll go to Dr. Google. They'll start taking psyllium or changing their diet, or go on the gluten-free bandwagon like a lot of people have done today. So they'll be going to talk to Auntie Mary about it, or Uncle Phil. They'll go on Facebook, or they'll start chatting to people about it. And after a while, they stop talking about it because people often get sick and tired of hearing other people talking about their health complaints, so they tend to shun those kind of people. So if you've had a dodgy tummy for a long, long time, you may just keep it to yourself. So, as I mentioned, 10% of all, or 10 to 15% of all people have got this problem. Now this accounts, irritable bowel syndrome accounts for about 10% of all doctor visits. So 1 in 10 patients who see GPs, medically trained doctors, actually have got irritable bowel syndrome. So they go to talk about that. And in many cases, after 10-15 minutes, they're sent away with some kind of a drug, like it could be a drug to stop diarrhea. It could be a drug to stop constipation. It could be a drug to alleviate spasms in the bowel or pain. And often it'll be after 10-15 minutes. Now, if you keep going back complaining to the doctor about this problem, you'll get sent to a gastroenterologist or a digestive health specialist. About 50% of all visits to gastroenterologists include irritable bowel syndrome. So what the hell is irritable bowel syndrome? What the heck is this problem? Well, think about the word irritable. So it's an irritation of the colon, of the bowel. And we're going to talk in a minute about, some of the primary causes of this problem. But there are 3 categories of irritable bowel syndrome. And the 3 categories are IBC, IBD, and mixed. So irritable bowel syndrome constipation, irritable bowel syndrome diarrhea, or you can have mixed constipation and diarrhea alternating. Some people, in fact, who have this irritation of the colon have no constipation or diarrhea. They just get spasms or pains. I've seen patients who say it's like someone shoved a knitting needle up my backside. Could you imagine that? Sitting there and all of a sudden someone poked a long knitting needle up your bum? Wouldn't that be painful? Other people will get little spasms or twitches or darting pains. Ooh, they get like little shooting pains in their gut. So if we look at the colon, we're really looking at sort of this area here, okay? So the belly button is here. So we're looking at a condition that involves this part of the digestive system. If you've got a problem higher up, well, it's obviously not the bowel, is it? I mean, unless your body's made differently from mine, but my bowel isn't up here. My bowel's down there. So the colon is what's get irritated. And that's what we call irritable bowel syndrome. And remember, if you're watching this and you've got a problem with the bowel, are you a person who seeks help? or self-help, or do you talk to a practitioner about it? It's very important to find out what the heck's going on with your bowel. In the next video, we're going to be talking about the causes of irritable bowel syndrome. Click on the link below if you haven't already got my free CanXida report, and we'll check you out in the next video. Thanks for tuning in.